Shoulder pain is something we all deal with at some point, but for some of us, it's constant. You know, the kind of pain that just doesn't let up no matter how much you stretch or rest. But what if I told you there's a way to fix it without jumping straight to surgery? Stay tuned because today, I'm going to show you how to not just treat shoulder pain, but actually fix it for good. Hey, I'm Dr. Jeff Peng, and welcome back to my channel. If you're new here, my goal is to help you live a healthy, active lifestyle. If you've been struggling with shoulder pain or rotator cuff issues, this video is for you. We'll dive into the causes of shoulder pain, specifically rotator cuff disease, and I'll walk you through an exercise program that's designed to rehabilitate your shoulder, help you feel better, and get you back to doing the things you love, pain-free. Now, let's get into it. You may not know this, but almost everyone is at risk of shoulder problems. Whether you're doing overhead work, playing sports, or even just spending long hours sitting at a desk, the risk is real. For some of us, the daily grind, whether lifting weights, lifting groceries, or lifting kids, can lead to serious wear and tear on the shoulder joints. On top of that, if you're physically inactive or have poor posture, you're at even higher risk. Sitting too long or slouching at your desk can cause tightness and weakness in the shoulder muscles. And the sad part is, many people don't realize they have a problem until it's too late. So, what's going on inside your shoulder when you feel that pain? The culprit is often rotator cuff disease. It's not just one issue, but a progression of problems in the shoulder muscles and tendons. The rotator cuff is made up of 4 muscles, the subscapularis, supraspinatus, infraspinatus, and teres minor, that work together to stabilize your shoulder joint. And when one of these muscles gets weak or injured, the whole system starts to break down. It all starts with something called subacromial impingement syndrome. This is where the tendons get irritated as they rub against the bones in the shoulder. If left unchecked, this can progress into partial tears, full-thickness tears, and eventually massive tears in the rotator cuff. And let me tell you, that's not a place you want to be. But before we dive deeper, let's talk about the shoulder anatomy. The shoulder is a ball and socket joint, which means it has an incredible range of motion. But this flexibility comes with a cost. To keep the shoulder stable during movements, especially overhead motions, muscles and tendons help hold the ball in place within the socket. The most important muscles here are the rotator cuff muscles. These muscles keep everything running smoothly, but they sit in a very tight space called the subacromial space, right beneath the acromion bone. When anything compresses or reduces the space in this area, it leads to irritation of the rotator cuff tendons and the bursa, the cushioning around the tendons. Now, when there's dysfunction in the shoulder mechanics, whether due to weakness, imbalance, tightness, or even a tear, everything starts to go wrong. The shoulder joint becomes unstable, and instead of moving smoothly, the ball of the shoulder migrates upwards, rubbing and compressing everything in that narrow subacromial space. This constant compression leads to inflammation in the bursa, a condition called bursitis, and can also lead to tears in the rotator cuff. The more this happens, the worse the problem becomes, until you're left with a major tear or even rotator cuff arthritis. Symptoms are pretty predictable. You'll feel pain, especially with overhead motions, things like lifting, putting on clothes, or reaching for something above your head. Sometimes, the pain is worse at night, especially when you lie on the affected shoulder. If you're not sure if you have rotator cuff disease or subacromial impingement syndrome, there's a quick test you can try. Stand with your arm relaxed and slowly raise it toward the side of your head. If you feel pain between 60 and 120 degrees, that's what we call a painful arc, which could indicate that the bursa is being compressed. This is a strong sign of rotator cuff disease. Okay, so we know the problem now. But how do we fix it? The goal of treatment is simple. Restore the smooth, pain-free motion of the shoulder. The issue is dysfunctional mechanics. Basically, your shoulder isn't moving like it should. The best way to address this is by strengthening the muscles around the shoulder, fixing any imbalances, and improving your range of motion. When you do this, you eliminate the compression that's causing the pain and inflammation. And here's the thing, just taking anti-inflammatory medications like ibuprofen or naproxen might help in the short term, but it's not a long-term solution. These medications can reduce inflammation and pain, which can make it easier to do the exercises that will actually fix the problem, but they won't address the underlying cause of the dysfunction. Now, a lot of people ask me, why not just go straight to surgery if there's a tear? Well, here's the deal. While surgery can repair full-thickness rotator cuff tears, it's not always the best option, especially for partial tears or subacromial impingement syndrome. Studies show that conservative treatments like physical therapy and exercise are just as effective, if not more, than surgery in many cases. Even for people with large, full-thickness tears, many can do well without surgery if they're committed to a proper rehabilitation program. The key is to restore those dysfunctional mechanics and get your shoulder moving smoothly again. Which brings us to the exercise program. A good rehabilitation plan is crucial. It doesn't matter if you're doing this at home or in a physical therapy clinic. The key is consistency and dedication. Studies have shown that home-based shoulder exercises are just as effective as physical therapy for treating many shoulder conditions. But, just like anything else, results don't happen overnight. To see real improvement, you need to stick to the program 3 to 4 times a week, at least for 6 weeks. Let's walk through an example of an effective rehab program. But first, warm up. Always warm up before you start any exercises. Start with shoulder rolls, 10 forward and 10 backward. Next, we'll work on the scapular stabilizer muscles. Simply squeeze your shoulder blades together and hold for 1 second. Do this for 10 reps. Then we move to weighted exercises. Grab a light dumbbell, a water bottle, or a resistance band. Start with a forward shoulder raise, bringing your arm to 90 degrees and slowly lower it. Repeat for 10 reps and do 3 sets. Next, do a side raise, reaching your arm to the side until you hit 90 degrees. If it hurts around 60 degrees, stop there. The goal is gradual progress. Then we'll work on shoulder extension. Reach your arm backward, not all the way up, just to around 45 degrees, and do 10 reps. After that, we'll focus on shoulder rotation, external and internal rotations. These exercises help improve mobility and strengthen the rotator cuff muscles. Finally, do rows. You can use resistance bands or dumbbells for this. Make sure your resistance band is securely tied to a stable surface. Do 10 reps. To target the trapezius, do a bent-over arm raise. Hinge at the hips and raise your arms to 90 degrees. This helps build strength in your upper back. Stretching is also an important part of your rehab. After you finish your exercises, spend some time stretching to restore range of motion and prevent injury. Start by opening up the front of your chest with a chest stretch. Clasp your hands behind your back, push down, and gently pull back. Next, stretch your shoulders with external and internal rotations, holding each stretch for 30 seconds. Finally, finish with a stretch for the back of your shoulder, gently pulling it across your body. Remember, consistency is key. Stick with this program 3 to 4 times a week for at least 6 weeks, and you'll start seeing results. If you stick with it, you'll soon be back to doing the things you love, pain-free. If you found this video helpful, don't forget to like, share, and subscribe. Let me know in the comments if you have any questions, or if there's a specific topic you'd like me to cover next.